My name is Marjana Marinac, and I will be providing this video abstract for the paper entitled Preferences for Outcomes Among Adults with Type 1 Diabetes and Caregivers of Children with Type 1 Diabetes. This study was funded by the JDRF International, where I am an employee, and the Leona and Harry B. Helmsley Charitable Trust, and conducted under a contract with RTI Health Solutions. Hemoglobin A1c is the gold standard for measuring efficacy in clinical and health outcome studies in type 1 diabetes. However, we wanted to understand the patient and caregiver perspective on outcomes used in day-to-day type 1 diabetes disease management. We sought to use the science behind patient preference studies to more robustly and systematically quantify the patient and caregiver perspective on outcomes in addition to hemoglobin A1c and to provide additional information on their clinical meaningfulness. A discrete choice experiment was designed where respondents, adults with type 1 diabetes and caregivers of children with type 1 diabetes, chose between pairs of hypothetical treatments in a series of questions. Each hypothetical treatment profile was defined by attributes with varying levels. 9 questions were asked of each respondent where the attributes were varied independently. 300 adults with type 1 diabetes and 400 caregivers of children with type 1 diabetes were included in this survey. The attributes chosen for this study included hemoglobin A1c, time in range, hypoglycemia, hyperglycemia, additional monthly costs, and additional time spent managing type 1 diabetes over each day. Please note that severe hypoglycemic events, which are those requiring third-party assistance, were not included as part of the attribute levels for this study, as the clinical meaningfulness of those events is understood. Our results showed that for adults with type 1 diabetes, avoiding 1 to 5 mild to moderate hypoglycemic events defined as a glucose between 54 and 69 milligrams per deciliter per week was 5 times more important than being half a point above target hemoglobin A1c. Avoiding 1 to 5 hyperglycemic events, which was defined as a glucose greater than 180 milligrams per deciliter per week, was 7 times more important than being half a point above target hemoglobin A1c. For the caregivers, avoiding 1 to 5 mild to moderate hypoglycemic events per week was 3 times more important than being more than half a point above their target hemoglobin A1c. And avoiding 1 to 5 hyperglycemic events per week was 6 times more important than being more than half a point above their target A1c. We also performed subgroup analyses and tested for differences in the preferences of respondents by their characteristics, such as diabetes duration and technology use, and differences were found. In conclusion, adults with type 1 diabetes and caregivers of children with type 1 diabetes prioritize reducing the number of mild to moderate hypoglycemic and hyperglycemic events based on the attributes and levels provided in the survey. These outcome preferences should be considered in research and development strategies, regulatory and reimbursement decisions for type 1 diabetes therapies. Thank you.